Hey everyone, let's have a real talk about something that's super important, but we often shy away from: sexually transmitted diseases, or STDs. Now, I know the topic can feel a bit heavy, maybe even a little scary, but knowledge is power, and when it comes to our health, being powerful is exactly what we want to be. Sticking our heads in the sand isn't a strategy. So let's pull them out, have an honest conversation, and learn how to protect ourselves and each other. So what exactly are STDs? The name is pretty self-explanatory. They're infections that are primarily passed from one person to another during sexual contact, and that includes vaginal, anal, and oral sex. These infections can be caused by bacteria, viruses, or even tiny parasites. Let's break it down a bit. On one side, you have bacterial STDs. Think of things like chlamydia, gonorrhea, and syphilis. Now, here's the good news about this group. They are generally curable. A course of antibiotics prescribed by a doctor can usually clear them up. But here's the catch, and it's a big one. If you don't get them treated, they can cause some serious long-term damage. We're talking about things like infertility, chronic pain, and an increased risk of other health complications. The scary part? Chlamydia and gonorrhea are often called silent infections, especially in women, because they might not show any symptoms at all. You could feel totally fine and still have it, and still be able to pass it on. Then we have the viral STDs. This category includes infections like herpes, HPV, human papillomavirus, hepatitis B, and HIV, human immunodeficiency virus. Now, these are a bit different because for the most part, viral STDs are not curable. Once you have them, they're with you for life. But please don't let that send you into a panic. Not curable does not mean not manageable. Medical advancements have been absolutely incredible. For example, people with herpes can take medication to manage outbreaks and reduce the risk of transmission. There are highly effective vaccines for HPV and hepatitis B that can prevent you from ever getting them in the first place. And for HIV, treatments have become so effective that they can lower the virus to undetectable levels. When it's undetectable, it's untransmittable. That means someone living with HIV on effective treatment can't pass the virus to their sexual partners. That's a game changer. So the big question is, how do you protect yourself? This isn't about being scared of intimacy, it's about being smart about it. Number one, and it's the most effective, communication. Talk to your partner. Before you get intimate, have an open and honest conversation about your sexual health and history. I know it can feel awkward, but your health is worth 30 seconds of feeling a little weird. Ask them when they were last tested. Share your own status. It's a sign of maturity and respect. Number two, use barrier methods, consistently and correctly. We're talking about condoms and dental dams. They are incredibly effective at preventing the transmission of most STDs when used every single time. Think of it like a seatbelt. You wear it every time you get in the car, right? Same principle. Number three, get vaccinated. If you're eligible, get the HPV vaccine. It protects against the types of HPV that cause most cervical cancers and genital warts. The hepatitis B vaccine is also a standard, powerful tool for prevention. And finally, number four, get tested regularly. This is so important. If you are sexually active, getting tested should be a normal part of your healthcare routine, just like going to the dentist. How often depends on your personal risk factors, but a good rule of thumb is to get tested at least once a year, and also between partners. Remember those silent infections? Testing is the only way to know for sure. Look, navigating sexual health can seem complicated, but it boils down to a few key things: being informed, communicating openly, using protection, and getting tested. It's about taking control of your own body and your own health. It's about respecting yourself and your partners. Let's end the stigma, let's have the conversations, and let's all commit to being safer and healthier together. It's not too late to start right now.